Well, hello everyone. I hope everyone is safe and sound during this pandemic. I would like to welcome you all to this new normal, thanks to COVID. But again, thank you everyone to join this webinar. The goal is I'll just quickly do a short introduction about myself, and then I would introduce our companies and the speaker and the panelist on this session. So starting with my introduction, my name is Vivek Kadam. I have been with I2E Consulting for about 5 years now, and I look after the sales at I2E Consulting India. Our company I2E Consulting is a software services providing company founded in the year 2008 in the US. I2E provides business consulting and technological solutions to large pharmaceutical companies like Pfizer, Merck, Abbott, ACG, Cipla, Novartis, etc. We are a Microsoft Gold partner, and we recently signed up partnerships with AWS and Automation Anywhere. Our major offerings, they revolve around Office 365 project and portfolio management, data visualization, and digital transformation. This event is co-hosted by our partner CONVALgroup. CONVALgroup was incorporated in the year 2000 as a company with a mission of serving as consultants and technology enablers to life sciences industry for increasing need of compliance and quality in various business units of pharma industry. CONVALgroup provides services around production, quality control, quality assurance, information technology, track and trace, serialization, and verification, validation, etc. On the panel, we have with us today Mr. Timur Kabadayi. Uh, Timur, I would request you to show the next slide, please. Yeah, so on the panel, we have with us our speaker, Mr. Timur Kabadayi. He is the managing director at CONVALgroup. He has around 30 years of experience in the pharma domain. He's a strong business development professional with a demonstrated history of working in the pharmaceuticals industry. Computerized system validation, verification and validation, change control, document management, and GMP are some of his strong areas. When not working, he loves traveling with his family and exploring new places. He's also very curious and keen to learn about what is new in the technology world in his free time. We have Mr. Arjun Guha, Director of Operations at CONVALgroup, with more than 25 years of experience of working in the pharma and the life sciences industry. He's a SAP PP 7.0 certified, CISA certified professional. He's experienced in quality assurance, strategic operations management, project quality management, serialization, track and trace for global projects in pharma and healthcare. We also have Ms. Banu Refik. She is a senior consultant quality at CONVALgroup. She has about 20 years of experience in pharma industry, working as a validation manager, project quality manager, and senior validation consultant. Now, as you all know, today's topic is remote document approval and management during this pandemic. So without any further delay, I would request Timur to please start the session, and I hope everyone is able to see the screen. Yeah, over to you, Timur.
Okay, thank you very much, Vivek. It's a great pleasure to have all of you guys in here in this webinar. So, and then I hope everybody is safe and sound at their places, at their home, at their countries. Okay, so what we're gonna do today is today mainly we will discuss about remote approval of the documents during this pandemic, and then we will use this frame MHRA guidance document especially to come up with how the agency, one of the agencies, predominant agencies from UK has seen how we should be approving the documents. And I know that That's one of the biggest challenges that we have faced during this pandemic, and it's going. And then, you know, although some countries has put they say it's a normal, but this normal can stay with us, and I think will stay with us minimum 1 year. And then during that time, you know, how we will be struggling and how we will be solving this approving of the documents, which is one of the key areas in our pharmaceutical world. So in this webinar, what I will go is I will just go about MHRA guidance document and give some examples about how this should be handled. And then over there, I will bring a couple of compliance strategies with my experience in working in pharma industry and then working with multinationals. You know, how they cope up with this, and then what are the benefits, and then how we should be doing this. And at the end, then we will have a Q&A session. So one thing is for sure, so we will be with us, you know, all the team will be with us for, you know, 1 hour together with you guys. But what I like to do is, what I do encourage you is, you know, please do write in Q&A your questions. Then each of your questions, we will go through each of your questions in detail, and then try to answer also your questions with our best of our knowledge and best of our experience that we have faced and that we will be supporting. So in the panel, as Vivek said, we have Arjun. He has many years of experience in pharma, and then he has been working with Novartis for many years. So he will bring also a lot of information, a lot of knowledge from the Novartis and from the global company and how they are doing this. And then we have also Banu with us. So Banu is right now the president of ISP GAM5 chapter in Turkey. Basically, she herself has established that chapter in Turkey, and then she has also very good connections back in also ISP and GAM5. And then she will bring also, you know, with your questions, what should be done, and how everything can be handled with this approval process. So that's basically the idea. And then, as I told you, please do ask. You know, I will just go through this presentation, but with your questions, then we can share the knowledge and then your pain points, what you are facing, and then, you know, we can cover these ideas together with you guys. So let's begin. Okay, so how we will do it? Because, you know, the basically what happened is, as soon as this pandemic has started, you know, and I have to say, the only guidance that brought us is from the regulatory agencies about the approval of the documents from home, basically was from MHRA. Okay, so what I would do is I will go through their regulations, okay, through the regulation, how they suggested that we should be approving those documents. So before going to that, let me share their also their suggestions, like from their website, right? How they foresee how the documents must be approved. So this is their, okay, so please, okay. Let me go back to the presentation. Sorry. Okay, let me click on this. Okay, so basically what they say is, so this is their website, how they say approval of the GXP documents when working from home. So I will just go through that information, and then, you know, put, you know, what you gotta hear is about, you know, how they should be approved, and then what should be their compliance strategies. So let me go back to the presentation. So first, what they say is, MHRA says, you know, if you are using an existing electronic system, they say, please do follow your existing electronic system. So this is no issue. But if you don't have, then what happens? So what happens is, I know that most of the companies are still approving the documents through the paper documents, then, with wet ink signature. So how they should be cope up with this? These are some of the examples of the documents, like validation protocols and reports, risk assessment, technical reports, or SOPs, any type of this document that we use to sign off, you know, like with wet ink when we were at the facility. But most of us, when we go back, and then if you are from your home, how you gonna approve those documents? So this became one of the biggest issue that we have faced in the industry, and then this is unsolved problem. So how we should be coping with that? And then MHRA says that, what are the alternative methods that should be done through this pandemic period. So what they say is basically, so one they say is during the alternative methods, you should follow this principles of to maintain of the controls. So when you say, regardless of what your system use and what the process uses, so you should be following those principles. One of the principles is risk considering the type of the document and the methods. So when they say this, so the risk is, there could be some documents that could be associated with high risk, and there should be some documents that should be associated with low risk. So I will come to this. So one of them is, if you're gonna approve, for example, a release of the product is a high risk. So when you are, for example, when you are releasing the product through signing, in the old good days with your wet in signatures, and then when you are at home, when you wanna sign this document, how you should be doing this. Okay, so this is the first thing. So you should consider, when you are applying your signature, right, onto document, based on the risk of the document. This is the one thing. Just keep in mind, then I will come to this later on during the presentation. And then the other thing is, when you perform a signature, right, remotely, so it should be equivalent to the handwritten signature of the signatory. So this is the important. And the third principle, what the MHRA says is, basically, when you are signing a document remotely, so it should minimize the risk that later on you should not say that it wasn't me. So keep in mind these three principles, and then based on these three principles, then we will come some of the examples that we're gonna give later on during the presentation, how we should be doing this. And then again, when you look for the risk with the remote approval, right? And then its most important thing is, attributable to an individual. So, we should be ensure that whoever signed this is that person. So the best example for this one is, it's not acceptable, for example, let's say you have a signature which you write, which you sign on a JPEG, and then later on, then you just copy and paste your JPEG to a document. This is not acceptable, because anybody can copy and paste your JPEG signature to a document. So this is attributable to an individual. That's what it means. And then later on, another risk is whether there is a legislative requirement or GXP guiding for a signature. So then it means that you should put more control over of this. So for example, when you are signing, as I said, product release, enable to release for sale. So it's not enough that you just sign and then get a photo of this and then later on just send it to an email. So this is not acceptable as well. For example, what is not acceptable is, so through an email chain, a QP says that I approve to release of this document through the email chain. For example, this is not acceptable. So we will come to this, how we can tackle this. And then again, if you are applying an electronic signature, so it should be applied by the owner of the signature. So I will give this example later on about that one as well. Okay, so what are the alternative methods? Risk with the remote approval. So we have to see, you know, if you are approving remotely a document, I am not saying if you are approving a document in an document management system. So the validated document management system is basically there, you know, to when you apply your signature, it is validated, it is there, so this is not an issue. But when you are doing the remote approval not through a system, so what are the risks? So first, how to act of signing is recorded so that the document cannot be altered or manipulated without invalidating the signature of the the status of the entry. Second one is ensuring that all required associated data is available to the remote reviewer that would have been available to them if they are performing the review at the site. So what does it mean is whoever signing the document should get all the information, all the document associated with it. So at the end, they can say that, yes, we have seen all the data and then it's available to me, then I'm approving this. So these are the two things that should be very well and carefully designed so that, you know, this risk during the remote approval is not there. So let me go with the MHRA approval examples. So what they say is, let me open this. So Arjun, can you see my screen with MHRA?
Yeah, I can see the screen.
Yep.
Okay, perfect. Very good. So what MHRA is basically saying, right? You know, here we will go to those examples much more detail. For example, what they say is you are at home and then you are approving a document. So what they say is, okay, I understand that you cannot approve a document in the electronic means, for example, in the document management, but you receive the document, right, in your hand through the email, right? For example, you are approving an SOP. So what they say is, okay, get a blank paper. When you get a blank paper, so then you can write on that blank paper, for example, the number of the SOP. Here in this example, what you say is they say, if you write, I approve this document and then the name of the QA and then sign and then get the date, you know, they don't need to be pre-printed. You can write with your hands also. This is not enough, they
Timur,
say.
sorry to interrupt, but we
Yes, please.
only see the presentations slide. Are you trying to show us something else as well? Because
Yes,
all I
please.
can
So I'll
see,
show it.
yeah. Please share that
Okay.
information that you're talking about.
Vivek, can you see it?
Yes, I can see it now, and I'm sure the participants are also able to see.
Perfect. That's what I'm saying. First thing
Sure.
what they say is, okay, what is accepted? Okay, before it was not accepted. For example, you know, when you sign a document, they say it should be electronically done or with vetting. But imagine you are at home and then you want to sign a document. So how you can do it? So one of the way of doing is you print the document. You know, you print. If you are at your home, there is a printer. You print it. You get the document at your hand, and then when you get your document at your hand, and then you sign the cover page, and then you scan it and you send it back. Yes, that's acceptable. But imagine at your home you don't have a printer, right? And then you cannot even scan the approval page. Then what happens? So MHRA says what you can do is basically you take a blank sheet and then you write on the blank sheet. So this is wrong one. So let's say this is not acceptable one, but you can write on the blank sheet procedure, for example, SOP reference version, so that you know there is a full traceability of the document that you are signing with, and then you don't need to let pre-print it, but you can write with your handwritten, and then blank page, and then you write the SOP reference, which document you are signing, and then you say approved by, even with your handwriting, your name, your position, and then your signature and date. Now, and then you get the photo of it with your mobile, and then you send this photo, and then later on attached to the document, they say it's acceptable. So this is very new. So when you look from the agency perspective, you know, they would never accept something to be get JPEG and approved through, get through the JPEG and get the photo and sent to them. So they used to not to have this being accepted, but now because of the pandemic, they say, you know, when you are at home, I stress, when you are at home, and then get a blank page, and then when you write the procedure, you know, the name of the procedure, the reference of that one, it could be a validation plan as well. You know, you write the validation plan number, the version, and then approved by your name, and then your position, your signature, and then your date of the signing, and get the photo and send it back through the email, right, or through the WhatsApp or whatever, through a communication man, and this is printed and attached to that document later on, they would accept it. But here is the trick. So what they say is, only if you put, I approve this report, so they say it's ambiguous because your signature is not linked to the document. So this is a very good news, because imagine you are at home, and then, you know, you don't have the printer, you don't have the scanner, you know, you cannot print the cover page of the document and get your signature and then later on send to them. So what they accept is, they accept that when you write the procedure and SOP reference number, your name, position, signature, and date, then they will accept it. So I think this is the new, very new acceptance of the agency, at least MHRA, but I think all European and FDA would even accept this, you know, to accept the documents to be approved from home. I think that's the new one. That's the new paradigm, let me put it that way, that forcing us to get the documents approved during the pandemic area. So let me go back to the presentation. Okay. So this example shows that how MHRA sees the approval process during the pandemic. But okay, so for a SOP, maybe that's acceptable. But when it comes for critical documents, then what happens? Like releasing of the products. Let me come to this one later on. In order to understand this, now this is a little bit about how we see as a CONVAL, you know, how we should comply with this, because, you know, when there's a risk is involved on approving the documents, then we should approve, we should think about, you know, the document types. So, you know, we know that risk approach is very, very important in our life, and then risk management has become one of our integral parts of a pharma industry. So let us think about the different type of documents, how we should come up with the different type of documents, and then the compliance strategy regarding the remote approval. So this is, again, this is not set in the regulatory guidance document, but that's what we feel, that's what we see as CONVAL, how we should be coping with this. So I think this a little bit, again, as I reiterate, this is coming from us as a consulting company, that we suggest that how you should be doing it. It's not like, you know, must, which is dictated by the agency. So what we look is in the compliance strategy, GXP and non-GXP type of documents. So here we come up with when the document is non-GXP. Here are some examples. Commissioning documents, right? You know, when you are doing the validation, there are commissioning documents related with the equipment, or design documents, or tests for non-GXP modules in an application. So here we can clearly use chain email. So what does a chain email means? You know, first person sends the document, right, with the chain, and then later on the remaining of the parties who are part of this chain says that I approve this document, I approve this document, I approve this document, and then later on this chain email is saved as part of the document and then kept as approval of these type of documents. But with chain email, it should be clearly understood. So for example, I am the originator of the document. I sent first approval, of the document. So when I sent the document, the document comes as an attachment with the chain email. So this is perfect. But what we should not do as the second person is basically only forwarding of your approval to the rest of the parties. Because what happens is when there's a chain email is going, when you forward, the attachment is not coming along with the second person who's going to approve the documents. So it should be done in a coordinated manner. So what I mean is a coordinated manner. Whoever sends the first time the document, so you should reply to that person as the first approval, and later on the second approval, third approval, with the document that you are approving the document. So whatever the document that you approve should be as part of the attachment of that document. So this is very, very important. So then a chain email would be accepted, not a forwarding between the parties, because when you forward, the attachment of the email, which is the original document, would be missing, and then later on, whoever approves this cannot say that, I have seen the document. So this is important. And then when the chain email has begun to move between the approving parties, nobody should go back and change anything on the document. So in order to ensure that, the document must be sent through the Acrobat version, not a native version, so that everybody should approve an Acrobat version of the document, which cannot be changed. So this is important. Now, when we come back, GXP documents. So here are some GXP documents. What we said is there are direct effect of this GXP document back to the product quality. So here are some examples. For example, CFA, certificate of analysis, test methods, batch release documents, or first time created an SOP. You create the SOP first version. So these are direct product quality related documents that we see. Here, that we feel, although MHRA does not says clearly, does not says clearly only photo is enough, but what we feel is here you should do a digital signature. So this is very, very important. There is no regulation for that one. MHRA, for example, does not enforce this, but we do feel that digital signature is here very important, because when you sign with the digital signature, the PDF of that document, then we are for sure that this is associated with that person, because digital signatures, example in Adobe, is associated directly with that person within that company, and then later on that person cannot say that I did not sign digitally, this signature does not belong to me. So our suggestion is, when there is a direct impact of the document is associated with the product quality, then it should be done through the digital signature. So what does it mean is, of course, that's a cost associated with it. And each digital signature costs, I don't know, 10 euro, I don't know, 750 rupees per signature per month. I would encourage the companies to do this type of signatures for the direct product quality related documents with the digital signatures, because with this one, then there is no discussion who signed and who was really signing the document. So that's what we say. And then when it's indirect related, for example, like validation plan, validation report, or functional specification, or even version of the SOPs, training records, right? Then you want to use scanned or approval sheet of the photo. So this is what we suggest for the companies, right, during the COVID, so that they can sign their documents. They can sign their documents with a very simple way, just getting a blank paper, writing on what they sign, and then sign it, get it the photo, and send the photo, so that that document can be pushed to the next step and that document can be approved. But here, what we feel there are some gray areas that just I put it here, like kappas, change controls. So, how can be done. So this is for us still in the discussion, because a kappa could be a direct impact of the document, or change control could be a direct impact of the product quality related. For those ones, I think the QAs should sit together and then make a decision which way they want to go ahead, and then which way they want to have this document to be signed, and then later on, just make a decision. So this is basically what we see on the compliance strategy. And let me go back and just go over this, because this is a little bit what we feel it's important to reiterate how we should be doing this. Basically, what we suggest as CONVAL is for non-GXP documents, these are some type of the documents, chain email would be okay, just pushing it. But here, just to remind you, chain email could be only and only acceptable if the document cannot be changed during this chain. And then, like whoever is approving is really getting the document, and who approves that document with as an attachment. So that's important. And then secondary, for GXP direct documents like CO phase, test method, batch release documents, we do suggest that you use digital signature, such as in Adobe, right? So there is of course, involves some investment, some cost, but at the end, so the document by itself is directly product quality related. So then there is no question who signed and when it's signed, and then so this is important. And then when it's indirect related documents, like maybe like 80% of the documents that we sign can be done through the blank paper, getting a photo and sending the photo of that document, of that signature, should be accepted. So these are the items that should be considered. And here let me reiterate again, like kappas and then change controls should be taught very carefully, and then how they should be approved should be discussed internally with the QA, and then make a decision based on whether it's gonna be approved through the digital signature, or just signing through a photo, taking a photo of the blank paper would be enough. So basically, that's in general. I went very fast on the ideas, but basically, what MHRA, so MHRA's recommendation is, I just covered this understanding, and then what we can do is right now. So if there is a questions, if you have any more questions, then we can go over that questions in much more detail, and then create a platform for discussion on this. But before going that to the Q&A session, so I like to have some words from Arjun. How is his experience on especially signing with digital signatures in a global company? Arjun, it's up to you.
Hi, Timur, and hi, everyone. So basically, global companies now are also facing the similar situation as all of us. So in this particular scenario, it's very important that, we have to first have an SOP, which tells exactly what we need to do as far as electronically signing of any GXP documents or record. Generally, when we read a SOP, we see that the company is using lots of different tools for approving various processes. And these are like not captured in the electronic document management system properly. Like, for example, if you have procedural documents like SOPs or work instructions, are you using the one system for doing that? If that is the case, then there should be an SOP for that. Then if you are using, document management systems or processes separate from those which we talked about earlier, then that should be also identified. If the documents are submission relevant and you are using a separate tool for doing that, is that covered under an SOP? And if you are using computerized systems and you are storing lifecycle documentation, are you managing it, with a proper SOP, or, doing this in the right way? Generally, when you do a complete assessment of all your electronic validated systems and how you approve it, you will come up with gaps, and this needs to be identified, documented in an SOP. And as Timur was explaining, a digital signature or an electronic signature is a very good and efficient way of proving that it is a certified document, which basically I would like to explain a little bit about signature validity status. So there are three things which we need to remember. So if you are talking about an electronic signature, first is the document status. So whether the document status is valid or it is having an invalid status. That's the first status. Then the second one is the identity check. So it basically tells you that all the signers are verified, or if there is an invalid signer due to an invalid certificate. And the third one, which is generally not discussed, is very important from the data integrity perspective, but here it is document integrity check. So when you sign electronically with the help of any electronic signature, the document integrity check is working as an encryption at the back end, which basically tells you the document has not changed or only contains permitted changes. And in this particular discussion, I would just like to say that everywhere we are seeing people are using electronic signatures primarily as their core approval activities. But when it comes to where we store these documents, and are we able to sort of identify whether these documents are stored properly? So for that, whether we know which format is this being stored. So those are the things which are always missed out. So I just wanted to highlight three things here. Especially people forget about lab systems where backup and restoration is a standard requirement. And in that case, file format, backup software, and backup medium needs to be considered as a part of your verification checks.
Okay. Okay. Thank you very much, Arjun. Thanks for your inputs. So, I mean, again, before we go anything further, Arjun, do you want to add more? So what do you feel?
Are there any questions? I see some attendees are asking questions, but in the process.
Yeah, I think we have one quick slide deck as well, right, to share.
I mean, so, yeah, what we have is, while Arjun is speaking, right? So, especially the SOP part of this one is very important, right? If we decide to go this type of compliance strategy, right? Then we should be doing it through an SOP, immediate SOP. And then for this one, we have a slide deck, but I don't want to share it right now. Basically, that's a reiteration what we did. And then as Conval, what we did is we have created a work instruction that can be easily converted to an SOP. And then what we will be doing is at the end of this seminar, then we will be sharing all the attendees, whoever come to this seminar, this work instruction as a presentation, right? And then later on, they can convert this one to a SOP. And then, but before we go to that one, right? I like to have a couple of, give a word, like we have a Timur with us, and then he's very, very veteran in this area of computer system validation, right? Chinroy, you want to add something on this. So you became one of the part of the panelists. Okay. Okay.
Can you hear me now, all of you?
Of course,
Yeah.
of course, of course. Please go ahead. Please go ahead.
Thank you
Thanks.
Welcome, Chinmay.
Yeah.
Jem,
Chinmay,
welcome. So,
welcome
Arch,
again from California, and thank you very much for joining, Chinmay.
yes,
Thank you.
Chips, sorry for this one. I just push you to the panelists, but I want to have you also a couple of words, how things are happening, how you guys are doing in US. So you have many years experience in this area. And then, if you can share this one with us, then we will be more than welcome and more than delighted. Please go ahead.
Sure. I mean, I listened to you as well as to Arjun. I think you have mentioned all that we need to have in place, but the most critical thing is SOP, right? We are all talking about data integrity. And the reason we need SOPs for anything and everything that we do, I'm not a very big fan of paperwork, but SOP is paperwork. And that's the only thing that I would say, whatever your business process is, please have an SOP. The reason is consistency. Everybody in the company should know how things are being done, and it should always be done in that consistent manner. And both you and Arjun, that was his very first point. I'm making notes, and I said, good. It is being stressed. You did it, Timur, also in your presentation. Arjun came and stressed it, and that's excellent. Now, why is the FDA, what are they after? What are the regulatory agencies after in this remote approval of documents? Three things. Repudiation. They want to make sure that if I have signed a document in remote, and Timur mentioned it, but I know he didn't use this word, he said that how does the regulator know that it is me who has signed it and somebody else has not come after I have signed it and put somebody else's signature or has changed something in there. So that repudiation is very important, and we have to ensure that. Now in electronic systems, the technology binds your signature to the object, which is the document. There is a binding, and that is why he said the Adobe signature, that is technology. Sometimes it is worth paying that money to ensure that technology so that the auditor can feel comfortable and use things like Adobe and other things that Timur mentioned. And then, of course, authorization and authentication. Now, authorization, is that person authorized to sign? And, in electronic systems, that authorization is there because your name should appear in the list of electronic signature. That's the authorization. How do you do that in the paper world? Of course, the email is sent to you, and the document manager or your document has sent you that email, right? That you preserve that and say, okay, I got this, and then you print the whole thing out on your printer. And the last thing is authentication, that you are the person who you are, and that's what you say you are. So these are the three things, and that's everything has been mentioned. I just wanted to present it alternatively in a different way so
Yeah.
that people have different ways of understanding things. That's all.
So Chinmay, thank you for giving this very important perspective to the discussions, and really appreciate. And in fact, on the same topic, if you remember, we had discussions that we always have test cases proving things are working, but we never have test cases proving things are not working. So in the attempt to have an electronic system, we never ever have a test, particular case which says that invalid attempt to modify or delete electronic record in the application, which standard user must be recorded in the audit trail.
Excellent
And
point.
have we
Excellent
tested
point.
it? That's yes.
Yeah, good. Please carry on. But that's an excellent point. So that's why I go ahead and tell people, please automate. That provides the level of confidence to people around you that you're trying to sell your product to.
Very good. I mean,
So, Vivek, can we take the questions from the participants? I think we are like having another few minutes, so if we can pick
okay.
it up from there.
Yeah, Vivek, before you just close, I like to thank Chinroy, just to attending this or webinar, let me put it that way, and then from US and from California. And then, it was very pleasant to have you in also, right? With your extensive knowledge and extensive industry experience to just giving us the guidance. I like to thank you on this, right?
Thank
Yeah,
you.
thank you very much, Chinmay, for joining in. I see that it's pretty early for you, so yeah, thanks for making this effort. I think we can now take the questions from the audience, and I see a few of them in the Q&A section here. I will read it out to all the panelists, and then Timur, you can decide who wants to take which one.
Yeah.
The first one we have here is from Marshall Joseph. If I don't have a document scanner at home, and if I approve a document by writing in a blank paper as I approve the so and so document with document name, document reference number, and version name, and scanning the documents by using any mobile app like Cam Scanner or Adobe Scanner, is it acceptable?
Okay, Banu, can you take this?
Sure. Hello, everyone. Of course, as Timur mentioned during his webinar, we need to look at the risk assessment for that document. What kind of document is that, like the criticality for the GXP criticality and so forth. But if it was not at the high level GXP criticality, we can proceed how you mentioned it here. So we can write on a piece of paper and scan it by the mobile applications like scanners and Adobe scanners. So it will be acceptable, but please ensure that the risk of this document is mentioned and you have the SOP in place and explained your approach. So hopefully this one is answered. Would you like to add more, Timur, to my answer?
I mean, thank you, Banu. I mean, this, as Banu said and as MHRA said, yes, this is acceptable. I mean, this is new because, before this pandemic, this was not acceptable because for a very simple reason, like taking a photo and sending the photo was not acceptable before the pandemic times because, with JPEG, actually with a photo, you can change the photo. You see what I mean? You can alter the photo pixel by pixel, but the reality kicks in. We are locked in the houses. There is no other means to approve any type of documents, right?
Mm-hmm.
Then MHRA, at least, this is one of the agencies that said clearly I would accept this. The other, I haven't seen any from any other agency that was saying like this way clearly, and then putting a guidance document around this. but that's the only way that we can do, because this is like force majeure, and when there's a force majeure, we can do it. But again, this is only like, my feeling is this is only like a for certain of period, which will be hopefully not for 2 years, but for a shorter time. That's what I would say.
Great.
Okay, Vivek, up to you. The next question.
The next question is from Suresh Chandran. I see that he has raised his hand a couple of times while the session was on. So yeah, here it is. Do we need to have an SOP for approving documents electronically or manual system during this pandemic situation? Who would
I
like to take this one?
mean, yeah, I'll take this one. Actually, all the panelists took this one. Like,
Right.
Arjun said, I said,
Exactly.
Jim said, Manu said, yes, we do need a SOP for this. But, you guys are the lucky ones. Let me put it that way. So we will be sharing the work instruction that Vivek was saying as through the PowerPoint format with the group, whoever has joined this seminar, this webinar, and then you can take this work instruction and convert it to your SOP. The answer is yes. You should have an SOP explaining this, and as Timur would support me on this, is in the pharma world, it is like 60 to 70% of FDA 483s, warning letters, everything is related with you are not following the SOP. So nothing else. They would never question you when you are following the SOP, but they will question you a lot if you are not following an SOP, or if you are doing a process which is not linked to an SOP. So yes, we should have an SOP for this one. I would say the answer is yes, we should have an SOP for this one.
Okay.
Vivek, to you.
Yeah, great. I have one from Madan. He says, how should the GXP document be approved if digital signature is not available?
Let me take this. The approval of the document, again, for MHRA, they don't go in the risk assessment and saying that this document, that document, as I explained in this webinar. So they say any type of approval should follow the rules that I set through the taking the picture. But this, for MHRA, they say that's enough. But my feeling is if there is a high risk documents like releasing the product, I would say then you should follow the digital signature. So that's for me very simple. For a very simple reason, because with digital signature, the approver cannot say that it wasn't me, because this digital signature is assigned through the public key infrastructure to that person in the company, and then later on that person cannot say that it wasn't me. So if the high risk documents, that should be approved through the digital signature. And then we are seeing it in the multinational companies a lot, that most of the documents who are not part of any type of document management system, validated document management system, so they are signed with a digital signature. So basically you pay for it, then you go. Okay. Then I see another question here, Vivek, up to you.
Yeah, it is. Yeah.
Timur, I would also like to add here that just procuring electronic records, electronic signature system doesn't guarantee Part 11 compliance until you can prove it through a formal ERES and data integrity verification testing. And this has to be performed on the system, and it has to be based on every version of the system. So if we are using it for approving GXP documents, we have to have evidence of a formally tested ERES and data integrity verification tests being performed on the system before it is released for GXP approvals.
Perfect.
All right.
Thank you, Arjun.
That was very enlightening. We have another question from Sharad Tekde. He says, what is the expectation by US FDA for the case of remotely approving the document? Is it the same as MHRA expectation?
I mean, Timur, I want to give the word to you from California. We from the other continent, so I cannot say personally. I don't have an answer for this one. Do you have an answer for this one? Is FDA did come up with any guidance document, or what is your view? If
No,
FDA
I have.
didn't,
Yeah, I have not seen. Timur, my understanding is you had your major experience in Canada, correct? Apotex.
that's correct. That's
Oh,
correct.
that's a worldwide company. So you do have the experience. But right now, I think your question is that, is there any guidance? I would say no. And the reason is because of the agreement these agencies have amongst them that a regulation in one of the agencies is also a regulation for the other. So there is no need for all that. But the present trend in the regulatory world, folks, and I go to India very often and I see this question being asked mostly in India. What does the agency expect? What does the agency expect? And we are all talking about CSA, Computer Systems Assurance.
Yeah.
The fundamental theme of CSA and anything else is that the agencies will now come and audit you and say, tell me what have you done to prove to me I can trust this, and how can I trust this? Tell me what have you done. That's all. So as the Timur said earlier, do things to prove to them that this is authenticated, authorized, is cannot be repudiated, and they will take it. That's basically what the MHRA is actually holding your hands. That's what I call guidance, to tell you.
Yeah.
And if you can, just prove to them why you trust this signature, why you trust this document. Usually the VP of quality, right, who is in front of them. So they're holding that person. So also amongst all of you, when you work on the floor, just do it right. Just the way Timur said, he has mentioned all the things, and any agency will accept it, including Australia, everybody.
Nice.
AGA.
That's great. So we have another 2 minutes left. Please go ahead and ask any questions that you have. In the meanwhile, I would also like to remind you that this is a recorded session, and the link, direct link for the recording, will be available on both our websites, that is CONVALgroup's website as well as I2E Consulting's website. And also you should be receiving an email after this session, maybe tomorrow, asking your feedback and along with the link that will provide the recording of this session. So yeah, we just have another couple of minutes left. If you have any questions, now is the right time. We'll wait for another 2 minutes, and then if there are no questions, we will be signing off.
Okay, so just Vivek, this is Arjun speaking again.
Yeah, go ahead.
Just to reiterate what Chinmay was saying, that itself is a very important information considering from the agency perspective. And generally, when we look into such sort of verification checks on electronic records, not the paper one, we do not see any test cases which prove that the link between the electronic signature and electronic record are guaranteed and documented. Okay, so we need to have the right test cases to prove that this is done, or even like I do not see any test cases which says that the signature cannot be copied from one record to the other, even though it sounds like logical, but you have to prove it. The agency needs this as a proof, as an evidence.
Good. Thanks, Arjun. And then Vivek, up to you.
All right, so I just see one question just popped up. It's again from Marshall. Oh no, it's not a question. He's just thanking all the panelists. Yeah, thank you so much, Marshall. Thank you everyone, in fact, for showing up for this session. It was a very enlightening one, I would say. And just wanted to remind you all, whoever is attending this session, that we do webinars every month, and we actually are planning to do it fortnightly. So please follow our websites, our companies, and you will be updated with most of the information that we are sharing across with our customers, with our followers. So yeah, I think that will be all. Thank you once again for showing up for this webinar, attending this one, and I hope you send us your feedback soon.
Thank you.
All right, thank you
Thank you
everyone.
all.
Bye bye.
Bye bye.
Thank you very much.